This is really a fascinating study that we fortunately have been collaborating with Arcellx from the very beginning, and the design of this trial, which is unique because it's a synthetic receptor for BCMA. And they actually had an adapter technology where they would have like a universal CAR where you could actually choose receptors for. And they decided their first study was going to be in multiple myeloma, and they have their own unique receptor. And the Food and Drug Administration said, well, before you start doing with this adapter technology, we want you to put it in a regular CAR. And they said, well, sure, we'll do that if that's what we have to do. And the remarkable aspect of this is that really from the very beginning that we started to see responses, and really significant responses, even at the early portions of this phase 1 trial. And as seen by this is an updated most of the nearly completed phase 1 portion of this. The response rate is 100%. And what is truly remarkable about this is that almost every one of these patients achieved minimal residual disease negativity. The toxicity profile was very, very acceptable. And to see this type of response, really kind of blew our minds. As a matter of fact, this was seen by all of the investigators. We're participating in this with Mass General and Beth Israel, and to see these types of response, and it was just so encouraging. And the majority of the responses are quite durable. Matter of fact, we will be seeing the presentation on this. Is that the very first patient achieved a stringent complete response and has a response of over 30 months, durable response. And we're seeing the majority of patients maintaining a durable response, has not even reached median duration of response. So this, I put this into context relative to other BCMA CARs. And it's, when you look at the lymphoma landscape, they're all using the same CD19 receptor, but but for every one of the myeloma patients, they're using a different BCMA receptor. And I really do believe that the receptor makes a tremendous difference. You even have some of the bispecifics you see with the Janssen product. It's going after 2 epitopes, but this synthetic BCMA receptor that Arcellx has developed, I think is quite remarkable. And I think it really shows maybe some of the areas that we need to be doing in CAR T cell therapy in general. So we're quite proud to be participating in this study.